Um, I'm here to talk about on pharmacology, the MOA, which is mechanism of action, and the uses and side effects of sedatives and hypnotics. So, our introduction: sedatives and hypnotics have played a fundamental role in clinical medicine for centuries. They represent a diverse group of pharmacological agents used primarily to depress the central nervous system, inducing a state ranging from mild sedation to deep sleep or even anesthesia, depending on the dose and specific agent administered. The term sedative and hypnotic are often used interchangeably. However, they refer to distinct, though overlapping, effects. Sedatives reduce anxiety and exert a calming effect, whereas hypnotics specifically induce and maintain sleep. Despite these distinctions, most sedative drugs can produce hypnotic effects if administered in higher doses. The modern pharmacological management of conditions such as anxiety, sleep disorders, and seizure disorders often involves the use of sedatives and hypnotic medications. Historically, compounds like barbiturates dominated this therapeutic area until the discovery of benzodiazepines, which offered improved safety profiles. More recently, non-benzodiazepine hypnotics, commonly referred to as Z-drugs, and other novel agents have expanded the therapeutic options available to clinicians. Nevertheless, the use of sedatives and hypnotics is not without complications. Issues such as tolerance, the need for increased doses to achieve the same effect, physical dependence, withdrawal phenomena, and various side effects are major considerations in their clinical use. This seminar report aims to provide a comprehensive discussion on the pharmacodynamics, therapeutic applications, and the adverse effects associated with sedatives and hypnotics. A better understanding of these aspects is essential for the effective and safe use of these agents in clinical practice. Our aims and objectives. The main objective of this seminar are to explain the mechanism of action of sedatives and hypnotics, to identify and discuss the therapeutic uses of these drugs, to highlight the side effects, risks, and complications associated with their use, to discuss recent advances in the development of safer and more effective sedative hypnotic agents. So, sedative and hypnotics overview. Sedatives and hypnotics are agents that depress the activity of the CNS, leading to a reduction in alertness, anxiety, and inducing sleep. Their clinical use spans several therapeutic areas, including psychiatry, neurology, anesthesia, and intensive care medicine. Style 2021. Although both sedatives and hypnotics exert CNS depressant effects, the distinction lies in their primary purpose. Sedatives are intended to calm or soothe the patient and decrease anxiety, while hypnotics are intended to induce and maintain sleep. However, many agents exhibit both properties depending on the dosage administered. The use of sedative hypnotic substances dates back to ancient times. Early civilizations used plant-based preparations such as opium, alcohol, and mandrake roots for their sedative properties. The 19th and 20th century witnessed significant advancements with the synthesis of oral hydrates and barbiturates, followed by benzodiazepines in the mid-20th century. Benzodiazepines largely replaced barbiturates due to their superior safety profile, especially in cases of overdose. More recently, non-benzodiazepine hypnotics such as zolpidem and Zalfon have been developed to offer better efficacy with fewer side effects related to dependence and cognitive impairment. Classification of sedatives and hypnotics. Sedative hypnotic agents can be classified based on their chemical structure and mechanism of action. Benzodiazepines. Benzodiazepines are among the most widely prescribed sedative hypnotics. Examples include diazepam, lorazepam, and alprazolam. They act by enhancing the effect of GABA at the GABA A receptor. You all know the GABA is plays an inhibitory role in the brain, so it slows down the brain. So that's what they enhance it. So that's how they work by to induce sleep, calmness, and all of that. So barbiturates such as phenobarbital and thiopental were among the earliest synthetic sedative hypnotics. They also act on GABA receptors but have a higher risk of respiratory depression and fatal overdose. Non-benzodiazepine, zolpidem, zeleflon, and ezopiclone are examples of newer agents called Z-drugs. They selectively bind benzodiazepine receptors with fewer muscle relaxant and anticonvulsant effects and generally a better safety profile. Other agents, antihistamines, e.g., diphenhydramine, have sedative properties due to the melatonin receptor agonist, e.g., ralmetion, are newer agents that mimic the action of melatonin to regulate sleep. We have the orexin receptor agonist, example, suvorexant, are emerging treatments that inhibits wakefulness, promoting neurotransmitters. So the pharmacokinetics of sedative hypnotics. The pharmacokinetics of sedative hypnotics, the absorption, distribution, metabolism, and excretion significantly influence their clinical use. Absorption, most sedative hypnotics are well absorbed orally. Their distribution, they are highly lipophilic and cross the blood-brain barrier easily. Metabolism, primarily metabolized in the liver through cytochrome P450 enzymes. Excreted mainly via the kidneys, often as inactive metabolites. Their half-life. Half-life plays a crucial role in determining the onset and duration of action. Short-acting agents are preferred for sleep induction, while longer-acting agents are used for anxiety management. So here we have a tabular classification of these things. Commonly used sedative hypnotics. Their drug, we have the diazepam, the class benzodiazepine. They primarily used for anxiety and also for as a muscle relaxant. So the lorazepam, also a class of benzodiazepine, used for anxiety also and preoperative sedation. Then phenobarbital, the class barbiturates. It is used for seizure control. We have the zolpidem, which is under the class of Z drugs. From their name, you will know they are all Z drugs, or another Z drugs. Then it's primarily used for sleep induction. We have the diphenhydramine, which is a class under antihistamine, primarily used for short-term insomnia. Ralmetion, class of melatonin agonist, primarily used for chronic insomnia. So, mechanism of action. The mechanism of action of sedative and hypnotics primarily involves potentiation of inhibitory neurotransmission in the CNS, most notably through gamma-aminobutyric acid system. So we have the GABAergic neurotransmission. GABA is a principal inhibitory neurotransmitter in the CNS. So activation of GABA receptors leads to the opening of chloride ion channels, hyperpolarization of neurons, and subsequent reduction in neuronal excitability. So there are three types of GABA receptors. We have the GABA A receptor, we have the GABA B receptor, we have GABA C receptor. Most sedative hypnotics act at GABA A receptor. Mechanism of action of different classes. Benzodiazepines bind to a specific site on the GABA A receptor complex and increase the frequency of chloride channel opening events induced by GABA. This results in enhanced inhibitory effects without directly activating the receptor themselves. Barbiturates bind to a distinct site on the GABA A receptor and prolong the duration of chloride channel opening, even in the absence of GABA. I think these are major differences here, the difference between barbiturates and these benzodiazepines. So that is why benzodiazepines are safer than barbiturates. So which explains their higher toxicity compared to benzodiazepines. Then we have the Z drugs, which are non-benzodiazepine hypnotics. selectively bind to the benzodiazepine site on GABA A receptors, particularly those containing the alpha 1 subunit, which mediates sedative effects. Other agents, antihistamines, antagonize the central histamine H1 receptors leading to sedation. Melatonin receptor agonists mimic the action of melatonin at MT1 and MT2 receptors, regulating circadian rhythms and promoting sleep onset. Orexin receptor agonists and antagonists block the action of orexins, neuropeptides that promote wakefulness, thereby facilitating sleep. Dose-dependent effects. The CNS depressant effects of sedative hypnotics are dose-dependent. So for low doses, it shows an anxiolytic effect. For moderate doses, sedative and hypnotic effects. Then for high doses, anesthesia and potential respiratory depression. That's for the high doses. This dose dependence highlights the importance of careful dosing and monitoring. Uses of sedatives and hypnotics. Sedatives and hypnotics have diverse therapeutic applications across various medical specialties. Their use ranges from short-term management of insomnia and anxiety to their role in anesthesia and critical care. Treatment of anxiety disorders. Benzodiazepines such as diazepam, lorazepam, and alprazolam are commonly prescribed for acute anxiety relief. They are effective in conditions such as generalized anxiety disorder, panic disorder, phobias, acute situational anxiety. However, due to the risks of dependence, they are typically recommended for short-term use. Management of insomnia. Hypnotics like zolpidem and ezopiclone are used to induce and maintain sleep in patients with insomnia. They are preferred for their rapid onset of action and relatively short half-life, which minimizes daytime drowsiness. Melatonin receptor agonists such as ralmeton are also used, particularly in elderly patients, to help regulate sleep-wake cycles without the risks associated with traditional hypnotics. Preparative sedation. Sedatives are often administered preparatively to reduce anxiety, induce amnesia, and facilitate anesthesia induction. Drugs commonly used include midazolam, that is short-acting benzodiazepine, lorazepam, and diazepam. Anesthesia adjuncts. At higher doses, sedatives like thiopental, which is a barbiturate, are used to induce general anesthesia. Benzodiazepines also play a role as adjuncts in balanced anesthesia, providing anxiolysis and amnesia. Anxiolysis is relieving anxiety or calming anxiety. So seizure control. Certain sedative hypnotics possesses anticonvulsant properties. Examples include diazepam and lorazepam for status epilepticus. So the phenobarbital for long-term seizure control, particularly in neonates. These agents help by enhancing inhibitory neurotransmission and stabilizing neuronal membranes. Muscle relaxation. Benzodiazepines, particularly diazepam, are used for their muscle relaxant properties in conditions such as multiple sclerosis and muscle spasm resulting from injury. Alcohol withdrawal management. Sedatives, particularly benzodiazepines, are the treatment of choice for managing alcohol withdrawal syndrome. They help prevent withdrawal seizures, delirium, tremens, and severe agitation. Critical care and mechanical ventilation. Sedatives are crucial in intensive care units for patients requiring mechanical ventilation. They ensure comfort and prevention of agitation-induced complications. Commonly used agents include midazolam, propofol, a short-acting hypnotic, and dexmedetomidine. Side effects and risks. While sedatives and hypnotics offer significant therapeutic benefits, their use is associated with a range of potential adverse effects and risks. These effects can vary depending on the specific agent, dosage, duration of use, and individual patient factors. So, common side effects, we have drowsiness and fatigue. A common side effect of sedative use is residual drowsiness and fatigue, which can impair cognitive and motor function, affecting things such as driving. Cognitive impairments. Chronic use of sedative hypnotics, especially benzodiazepines, is associated with cognitive deficits, including